Okay, so we're going to start by getting a skin tell reading. I'll actually touch this device. You're going to feel this touching your face. I just put a little Lux lotion on your face, and you're just going to feel this touch your cheeks. I'm going to take several different areas. And we can see we have 3 readings. I'm going to push the button. You'll hear bada bing. And here's her melanin index, which came up to 14, which is quite low. She's not tanned even though we're in summer. So I'm going to accept that reading. And with a melanin index of 14 at a pulse width of 20 milliseconds, I can actually go 42 to 44 joules, which is a little more than we have. And we're going to go a little more conservative. So we're set to go. So we've got our settings. For pigment, we're going to go 20 milliseconds, 40 joules per centimeter squared. Let's get our eye protection on the patient. And everybody will put their pulse light glasses on. Okay. So there's nice cooling in this tip. You're going to feel the cooling, and you'll feel 1 pulse. And you're going to just see a train of pulses coming down. If you need to break it all, you let me know. And in just a minute, Jessica will come in with the Zimmer chiller to chill you. So Laura, the Max-G is a phenomenal device. It's actually not a laser. It's an intense pulse light, but with a very specific spectrum that is made to absorb blood vessels, and it also gets pigmentation. So every laser or device hits a target, and this one goes after vessels and pigmentation. In your case, you have more pigmentation. Now, some of these are keratoses, and what we don't get with the Max-G, we're going to get with the 1540 fractional non-ablative laser. And we'll just get a look, and the skin looks perfect. So we like to see a nice little skin response. So here we're just going to continue with the Max-G treatment, which has a spectral filter that's very unique and different than many other technologies. The wavelengths coming out of here are 500 to 670. That's quite specific for superficial blood vessels, and it gets nice pigmentation. Then there's a filter that actually filters out bands that would not absorb hemoglobin. So in case we need to get blood vessels, we want to get coagulation with high energy and a short pulse width. So this device is better on blood vessels than any other IPL based on the spectrum. Now, if you had a larger, deeper vessel, we could shift the spectrum by lengthening the pulse width, and we'd get more energy in the back end of the spectrum at 870 to 1200 nanometers. If you have more superficial vessels, we shorten the pulse width to about 10 to 15 milliseconds, and then we get more energy in the front end, which is 500 to 670 nanometers. So there's a high absorption spectrum between 5 and 600 in the narrow band of visible light, green, yellow, that highly absorbs superficial hemoglobin. So this way I can use a device that has the power of a laser, but it actually is not a laser, to revitalize the skin. And this is our most popular treatment in the office. Everybody has a little bit of something that's color on their skin that they're not happy with, either a little bit of brown or a little bit of red. And that's from a little bit too much sun about 20 years earlier. So when I hit a lentigo, a sun freckle, and of course we're sure that Laura's had a good skin check and she doesn't have any worrisome or concerning pigmented lesions, she just has signs of sun damage, we're going to notice that there's a little immediate darkening, and tomorrow the brown spots that are below the surface of the skin will get very dark brown, almost like you put coffee grounds on your fingertips and put them on your face. Then they'll come up and slough off with the epidermal turnover cycle, and on most people in the face that takes about 5 to 7 days. Now there's nice cooling in this tip, and this is the most expensive and safe kind of cooling that you can have. Under the tip here, we have a nice sapphire crystal, and this crystal is maintained at a temperature of 5 degrees centigrade. There's a feedback loop to the laser and the Icon device where if it's not 5 degrees centigrade, we won't fire. So this is called dynamic contact cooling, and it's a built-in safety mechanism, which is fabulous because we always can count that our tip has 5 degrees centigrade cooling. And that protects the competing pigment in her epidermis, and we won't see any whitening, any blisters. Of course, those are potential adverse events from any laser or light treatment. So as we're treating, I actually see a nice tissue reaction, and this is what we want to see. We want to see that the patient is developing some confluent erythema around the targets. Those targets are called chromophores, and the chromophore for the MAXG, of course, is pigment and blood vessels. Little snappy there over the sinus, so she's going to see the light. So I'm going to remind her that her face is completely protected, her eyes are completely safe, even though you can see some of the light. And she has some lentiginous changes on her nose, so I expect a nice response. So we can see some initial darkening, and if we wait a few minutes, you see perilesional erythema, redness around the lesion, and that's our clinical endpoint. And boy, she looks fabulous. We're almost done with the MAXG. Let's turn all the way to this side. And I'm going to be able to treat her without moving to the other side of the table, which is very handy. I'll take a white gauze, please. Okay, just to pull the tissue down. Little snap there. But we don't want to miss any spots in the periocular region. I do want to always stay over orbital bone. I don't want any of the light in the infraorbital rim. And thank you, Jessica, for tractioning out the skin so we can get nice delivery of energy to our targets. Very simple and easy procedure for you to do. You can delegate this to your staff depending upon your state laws and your comfort level with your staff's education. So I'd like to cover the whole field, 1 to 2 passes until we get our clinical endpoint. And the last part will be the forehead, where she does have some light lentigos. And the forehead can be a little bit more uncomfortable. So my general technique is to start with the lateral face, come across the nose, go to the other lateral cheek, hit the chin and the upper lip if needed, and I finish up on the forehead. So the beautiful thing about this procedure is it gets brown spots and red spots. It's got a nice small spot, which is ideal for the face. If I was going to the décolleté, I would actually switch to the YS handle, which gets mostly pigment. That's a spectral output of 525 to 1200. So we'll put some Lux lotion in that 4mm tip. Thank you. So this 4mm spot will allow us to target a small little cherry angioma. We need to increase our energy by 30%. And fortunately, the MAXG has way more energy than you generally require. So we're going to go up on our energy 10 milliseconds for a small target. And we're going to go 46 joules per centimeter squared. And we'll just pulse at this little cherry angioma, little snap. Fabulous, and that darkened up nicely. I'll just give it a second pulse. We'll make sure we don't have any others. Now I also could, if I wanted to, do the same thing on the pigmented lesions, but I don't need to increase the energy, so I'll go 10 and 38. And actually, for some people that are having discomfort, you can also treat these little single lesions. This is also nice if you have cherry angiomas at the hairline, or if you have nasal telangiectasias inside the nasal ala. You can't stick the whole tip in there, so this 4mm adapter is a nice advantage. And you can see the beautiful darkening of these lesions. And this small tip is usually much more comfortable than treating the field. But you can see the advantage of speed of treating the field, and then you don't have any skip areas. So a nice skin revitalization.